Good afternoon. This is Bill Bird. I'm the Chief Medical Officer here at CGH Medical Center, and thank you for joining our Facebook Live broadcast. Today, I am looking forward to having our Vice President of Support Services, Cindy Zander, with me, and Cindy is going to speak about all things vaccine related here at CGH. We've had a lot of questions about that, and I thought it'd be a great time to have her on to kind of answer those questions that I have, as well as questions that you might have of her. However, before we get to that, I wanted to go through just the latest updates on COVID in the past week, just to share those with you, give you some more information about that. And as always, as I'm chatting with you, go ahead and send your questions my way. So, a few things that I thought were interesting this past week. There was a study that came out of the UK that a pretty commonly used medicine for asthma called budesonide, or Rhinocort is another name for it. They did a study on about 146 patients, and if they started that medicine within 7 days of the onset of their COVID symptoms, they tended to do a lot better. There were a 90% reduction in hospitalization rates and needing to go to urgent care. So granted, we need to do that on some more numbers of patients, but that's encouraging, just as kind of a treatment for folks who get sick with COVID. So I thought that was encouraging. I wouldn't be surprised if we see more of that used by our primary care folks for their patients. I'm not saying that that is a done deal, but it sure looks pretty likely, and I thought I would share that. So a study came out, a randomized controlled study, which this other one was not, about zinc and vitamin C. Don't waste your time. Don't waste your money. Don't take them if you're trying to prevent getting COVID. They're not going to help, and they're not going to help you get better if you have COVID as well. So just that's new information, and I wanted to share that with you. I think the three V's are going to be pretty important here in the next few months. I kind of came up with the three V's that I think are pretty important, and that would be the variants, in other words, the mutations that the COVID virus is obtaining and how that is spreading throughout the world, the vaccine in terms of getting it into people's arms, and then just vigilance on our part to continue to follow the masking and distancing and those type of things. I I am hopeful that if those three V's, if we can get that figured out, and I do think there's hope in that regard, that in the next few months there's going to be a really good chance that we're going to see a really continuing tapering off rather than another surge of this pandemic. And don't make no mistake about it. If those things don't go well, we could have another surge. And why? If we can just follow those three V's, I think we'll be in good shape. So we'll see. But that's just kind of my perspective on that. Finally, we're doing some monoclonal antibodies here at the hospital still. So if you're someone or you know someone who gets sick with COVID and within 10 days of the onset of your symptoms, you have certain high risk things that you have in terms of health conditions, we are still actively giving that to patients on an almost daily basis. So keep that in mind. The fancy name for that is bamlanivimab, or Black Betty is what we call it here in the pharmacy world. But keep that in mind as far as your loved ones and yourself. I do want to also just kind of once again share that this is still continues to be a big deal. It's there's a reason we're taking this so seriously. I was reading this week that in terms of deaths in 2020 per 100,000 people, COVID was number 3. So just to give you some sense of that, 164 out of 100,000 people passed away from heart disease, 149 from cancer, 123 from COVID, and then the next category was all the way down at 48, which was accidents. And keep in mind too that COVID really didn't hit hard in our country until like late February, March. So those other two diseases, coronary heart disease and cancer, had at least a 2-month head start. So COVID has been, and continues to be a big deal in our country. The other thing I saw some information about that I thought just kind of drives home the point of how important it is to, yeah, how important it is to take care of our most at-risk folks as best we can is when you look at the deaths from COVID, if you're between the ages of 5 and 17, your risk of dying of COVID if you get it, this is for symptomatic infections, is 1 in 9,259. That's 1 in 9,259. If you're over the age of 85, it's 1 in 5. So that's why it's so important that we get our older population immunized as soon as we can, because those are the folks that drive really getting really sick. Not that other people in other age categories can and don't, but definitely the older you get, the more illness you get. And if I remember right, like 50 to 59, which I'm kind of interested in because of my age, it's I think 1 in 89. So you start going up as you get in that, 50, 60, 70, 80, it really goes up. So yeah, that's kind of some numbers just to put that in perspective. I also wanted just to speak about some vaccine safety stuff because there's still, I think a lot of folks are willing to get the vaccine, but there's still some resistance. And here's the latest that I read on that. So for this was from mid-December to mid-January that these numbers were we have so far. 4.7 million. Oh, here's what it was. Of the millions of vaccines that were given for Pfizer, 4.7 out of a million people, 4.7 people would have an anaphylactic reaction or a really severe reaction out of a million people. And the Moderna was 2.5 out of a million. And as I looked into those numbers further, I wouldn't even say it was that high of a number because as they broke it down, about half of those people, they were for sure had an anaphylactic reaction. The other half, they had a reaction, whether you would call that anaphylactic or not is somewhat debatable. And the other good news of all those patients, all those people that had a reaction like that, nobody died. So that's really good news in terms of the safety of these vaccines. I know people, when they have the vaccines, oftentimes they don't feel real good for a day or so, but I wouldn't classify that as a severe anaphylactic reaction. And those people who don't feel good for a day or so don't pass away. So that's if you took that many people in the general population who didn't get a vaccine, obviously that would be a large number of people would pass away from COVID. So vaccine looks like it's so far at least working really nicely and really by and large really safe. So that's a great thing. And I'm thankful for that. Obviously, these variants may play some part in how effective the vaccines are. So I temper with that enthusiasm. We'll see of how the variants all play out. But for now, at least, that's really encouraging. Okay, that's my updates in terms of COVID. And I wanted to pull Cindy Zander in. Where's Cindy? Hi, Cindy.
Hello.
Welcome.
Thank you.
Glad you could join me today. So I'm going to rattle off some numbers, and then I'm going to start asking you questions, Cindy, because it kind of plays into these numbers. So if folks, and probably most of our listeners are probably pretty in tune to what's going on in our nation. And if you read the numbers this past week, 1.62 million people per day received a vaccine on average. 40 million U.S. citizens have had at least their first dose of vaccine, which is about 12% of the US population. So, gosh, you hear those numbers, and we probably have thousands of residents here in Whiteside County who have had their vaccine given to them, and we know that I'm being facetious. So, my first question to you, Cindy, is can you share with us our latest vaccine numbers and like how many have we given to our community so far? How many do we have on our waiting list? What age groups are we currently contacting when we have vaccine available? What's the latest on all that?
Sure. I can go ahead and update. As far as the community members that we've actually vaccinated CGH, which are our patients. We're just under 1,200, 1188 actually. As of this morning, we're vaccinated. 94 of those have had 2 doses, and the remainder have had the 1 dose. All the second dose clinics are already scheduled, so that we have a series of dates coming up for that. So that's what we've been able to do with the community. Obviously, this is driven by how many vaccines we are able to get, and that's been very limited. The health department is requesting as many as they can get, and we basically get what IDPH allocates. So we had the first week we got this, and this is when we started phase 1A, which was our employees. We got actually 600 doses. We've never seen that since. We've had a week of 450, and now we're averaging about 100. So we had 90 to give yesterday, and we have 100 planned for next week. We're constantly talking with the health department. We're on calls with them 3 days a week to continue to get updates. And anytime that we receive an update that vaccine's available, we're on it. As soon as we get confirmation, we have a group of people that work out of the main clinic that start to call patients and get people scheduled. And we literally can get people in that same week typically. The Pfizer doses have to be used in 5 days because they do come in thawed. So we activate very quickly, but in all cases, we get it in as soon as we possibly can. Anticipating it, we've blocked every Friday, hoping to get it notice that we're going to get a large number of doses. And if we get that additional dose, then we go ahead and we've got it all arranged to go ahead and do an 8-hour day, typically, to get started.
Yeah, good. I'm hearing that pretty soon we're going to start just kind of posting these numbers on our website. Is that right, Cindy?
Yeah, Dana and marketing have gotten that set up so that weekly we can post how many we've actually vaccinated of our patients.
Yeah. So I wouldn't be surprised if there are folks out there who are like, geez, I signed up for that wait list for CGH several weeks ago, maybe even a month or more ago. Why is it that I'm not getting a call back? So it just has to do with our supply.
Right. And I can tell you kind of how we've addressed it. Our philosophy was to start with the oldest people on the list. So we start with people above the age of 85. And we've successfully vaccinated the majority of those. We still have around 70-ish on that list that for a number of reasons have not come in. Some are snowbirds, some are waiting for a little better weather, things like that. Otherwise, we've taken that list and gotten those people scheduled. We still have over 6,000 on the list. As I said, as soon as we have doses available, we start reaching out. So that's really our rate limiting factor.
Yeah. It's just Donna's asking, why does Whiteside County Health Department not give you an appointment for your second shot when you get your first?
That's a good question, Donna, and I could follow up with Corey and let you know on that. We could provide an update. I wasn't aware they weren't scheduling. We're automatically doing ours just to keep our schedule moving, but I will ask him about it.
Yeah, good question. Marianne's asking, have you heard if any of the pharmacies been giving any yet?
Yeah, small numbers of doses. The Walgreens in Sterling and Rock Falls, we each received 100 doses, which don't last very long. That's a federally funded initiative, so they're the ones distributing directly to the pharmacies. Within our county, Whiteside County is giving some to some of the privately owned pharmacies. A lot of that is to help with frontline workers and helping to get the vaccine out. So there's a little bit that's available through the pharmacies, and we're hoping they're going to be getting more as time moves on.
Yeah, this was a question I was going to. If you weren't on a waiting list, we get a call from a nurse, or is it a voicemail, Cindy?
They're going to reach out to you. It's a direct person that's going to call you because they're going to call you to get that scheduled. So they may leave a voicemail if you're not available, but you will talk with a person. One thing we are working on, though, and it's not quite ready yet, is a way to do some automated scheduling where you'd be able to basically go through our app and get scheduled that way, but that's preliminary. They are working through it and doing testing right now, and that should help ease some of the scheduling and the phone calls back and forth.
Yeah, because if you get 600 people, that's a lot of phone calls to be making.
Yeah, they've been amazing, the
Oh,
receptionist group that's working on this.
yeah, that's a lot of, yeah, for sure. I was going to ask you this later, Cindy, but the question about the local pharmacies, let's say you wanted to expand your search a little bit and you're trying to get that vaccine sooner than the CGH would have it. How do you go about, is there work that has to be done to get a phone call from a pharmacy or to get on a list with a pharmacy to be on their vaccine list?
Yeah, they're all kind of, from my understanding, handling it a little bit differently, but I would just say calling them directly. Walgreens, I believe, is doing it more through their corporate. They have an app that people use, and you can reach out that way. It just depends. Illinois Department of Public Health, if you go to their site, there is some information there. You've probably heard that they're doing some mass vaccination across the country with National Guard. They're going to start doing that next week in Illinois, but unfortunately it's further away from us. So it's going to be central to southern Illinois when they start. But those are coming up. There's 2 scheduled for next week. We're hearing that they're going to come to Winnebago County, which would be the Rockford area, which would be much easier to reach. So when we get information like that, we'll post that information out there also so that people know that you can reach out and go to those clinics.
Right. But it would just be a matter of, are we just getting the Pfizer vaccine, Rebecca's asking?
No, we get both. It just depends what's shipped that week. This particular week, we did get Pfizer. Next week, it's Moderna. So we've kind of had, I would say it's about 50-50. They did tell us they had more Pfizer available, and we were hoping to get a lot at that point, but it hasn't happened.
Okay, yeah. And then we'll see with Johnson & Johnson, because I think it's the 26th that the FDA meeting is, and at least for the other products, pretty shortly thereafter, they started shipping that out, if I remember right.
Yeah, it didn't take too long, and I know they've geared up production, so.
Good. Sharon says, you all had a great setup when I brought my parents in for their vaccine. Well done. I only wish that people who do not have physicians at CGH could get vaccinated. There are very few places to go to get them at this time. So that's 2 parts. First part is, Cindy, yeah, your team and the folks that have set this vaccine clinic up, I've been down there. It is smooth. So can you speak to that first of all?
Yeah, there's been a lot of planning for that. It kind of ties in with our emergency management planning, actually. So there's some key people that set up the structure. But what we do is we have about 30 people that work each clinic, and we have 6 stations to inject and 25 chairs to recover or be observed. So it does go fast. We've tweaked it some so that we can get more people through, and we think we did a 400 clinic last week. We think that we could go above that. If we get more vaccine, we'd probably, in 10 hours, we could probably do about 650, even up to 750 if we can get 12 hours in.
Okay, yeah, that's great. So the other thing that was embedded in that comment was about non-CGH patients and getting vaccines. Here at the hospital, we have our waiting list that is basically folks who are part of our, have seen CGH here in the past. Can you speak to that, Cindy, kind of the rationale on our part as far as that goes?
That started when we worked with the health department. The way they've described it, and it was that as recent again as yesterday, that is they take doses for their needs, which is a lot of the frontline workers in some public clinics. Then they allocate doses to us for our patients. They allocate doses to Morrison for their patients. So that's kind of how it was set up from the beginning. We hope that we get to the point where we can order our own or receive large amounts and can go beyond that list and offer mass vaccination sites where we can allow people to come and do additional people above that.
Right. So that's kind of our directive from the health department. Take care of the folks you have on your list. Yeah. Okay. Hey, I want to circle back on one other thing that came up in this conversation already. You mentioned we started on the 86 plus category in terms of actually vaccinating folks. And that's part of why I shared that data before I brought you on, Cindy. I just wanted folks to remember that is if you're above the age of 85, your chance of getting really sick and dying from COVID are 1 in 5. So that was our thought process in terms of why we were going to start with that older age group. So I just wanted folks to hear that, and that's the
Oh,
backstory.
I do have one thing to add to that in case
Yeah.
you're hearing that people under that age have gotten it. We are accommodating all spouses. So as long as they're over 65 and they're coming and bringing their spouse in, we are doing both.
Okay.
So we have people younger that have received it, but they're all over 65.
Yeah. Joan's asking, she had an appointment at the clinic, and the doctor said that she'll be hearing from us soon. They're starting 80 plus soon. She's 82.
Yeah, that's our next group that we're targeting. And we've already contacted some when we have been unable to get additional 85-year-olds in. So hopefully we get doses and you do hear from us soon.
Yeah, but I bet you there's still a decent number of people in that 75 to 85 category.
There is. So it's going to take some time to get that entire group in, but we are starting to get into that age group now.
Okay. Yeah. Yeah, and I think you answered this, but in general, if once we get the vaccine in, we're getting that into people's arms by the end of the week.
Yeah, it's usually within a couple days. The way the scheduling works, the health department gets an update on Wednesdays. On Thursdays, they can place the order. They're told how many they can get. And then we typically get the deliveries on Monday. Now, with weather issues, and you maybe heard this on national news across the country, some shipping's been impacted. But as soon as we know they're coming, we're calling and we're scheduling people to come in. So we, like this last Wednesday is when we added on, when we knew our shipment was coming Tuesday.
Yeah, thanks. And thanks for your comments, Mary. Appreciate that. So, Cindy, let's talk about, in some ways, pie in the sky, but I'm hoping someday this will be the case. And that is, what if all of a sudden the health department were to say, or the government were just to say, we're going to directly ship you 2,000 shots this week? What are you thinking about that? How would we be able to? What are we thinking about in terms of accommodating those larger numbers?
Yeah, we would be very excited. We have a couple options. As I kind of referenced, we can ramp up here in this building. We probably would do that more on a weekend when there's less traffic coming through, and we could probably get 1,000 here. But our bigger plan is we've been out to the mall with empty stores like Penny's. It's ideal, and we have a really good option there to really do mass vaccination and get a lot of people through. So that's our plan. We're working on getting wireless and all that things set up for us, and then that's what we'll do.
Okay. Yeah, I know. I brought the question up because I know that your team you've been putting your minds to that, and you're actually doing some of the work so that if we needed to do it, we could. Yeah, and then I just wanted to make sure. So in our county, just to clarify something, hospital health department, if we get a vaccine offered to us, we're taking it and we're giving it.
Absolutely. There's been some rumors going around that Whiteside County Health Department had an option. I had heard several times they'd option to get 5,000 doses and opted out because of staffing.
Yeah.
Or they have actually sent out a press release that is not true. They will take whatever they can get, and they know that we especially can gear up fairly quickly with all the nursing staff. So they have never rejected doses, and he did put out some information on that. It's strictly a rumor.
Okay. Yeah. And I was wondering too. So right now our wait list is it 65 and over that we have on our waiting list right now, Cindy?
Yes.
Okay. Do we have any plans or any thoughts on your part about? I think the next tier is probably folks who have chronic health conditions.
Right.
Where are we at with that?
So next week, IDPH has made the decision to add at-risk people to the phase 1B. It's like part 1, part 2. We're not done with part 1 yet, but part 2 will add that grouping in. So in anticipation of that, we're going to start reaching out next week the same way we did on the first phase with either text or phone calls to get people. There's going to be links put out. You'll see them on our website where you can go in and get on the waiting list if you're under the age of 65 with risk factors.
Okay. Yeah, I wondered about that. So that's good. So what we're trying to do is stay ahead of. It sounds like we're trying to stay ahead of the curve, so that if we were to get a bunch of vaccine, at least we have a list of people that we can give the vaccine to.
Yeah, absolutely.
Yeah. Okay. Um, yeah, and then the other thing I wanted to kind of just go through again. So if we're doing our best every time we get vaccine, we're giving it out. So if folks wanted to expand their search, like they could have to go to sign up on like I don't know, Kroger or someone else's website. Is that what they would have to do?
Yeah, Walgreens, you can get on their website to look. As far as you can call Lee County, you can call these different sites. Some of the counties are able to take it. We're all allocated differently, which is a little bit frustrating because sometimes you wonder why certain counties
Yeah.
get certain numbers, but you can reach out to any of them. And then when these mass back sites start, if you're able to make the trip, you can go to those also, and they have information on the IDPH site to sign up.
Yeah. Good. So Cindy, first of all, for our listeners, I want to make sure that if there's any other questions or comments, that we give them an opportunity to ask those. But when you were thinking about what I might be asking you, Cindy, was there anything else that came to mind that you thought you'd want to share with the folks who are listening?
I think you covered the majority of what I had thought about. We're frustrated with you, and we're trying hard to get more information out. We know that it kind of you sign up and it kind of feels like a black hole, and we don't. That's not our intent. We are literally, as soon as we can get doses, getting those in arms, and we really, really are geared up to take care of it. So we hope that you hear news that we've received a lot, and you can come out to J.C. Penney's, and we'll get you injected and quickly.
Yeah.
We'll also do that here. So we thank all of you for your patience. We think it's a good process. We just got to get the doses.
Yeah. Rebecca said I had the first dose of Moderna January 29th, second dose February 26th, but can't find an appointment anywhere. Do you have
So,
any? Go ahead, Cindy.
did you get your first dose at the health department? I don't know if you can type any kind of answer. I'm not sure where you did your first dose. That makes it a little hard because our numbers are all synced up with our first doses. Um, I guess getting a little more information, we could help you and even reach out to you offline just to see what's going on with that. The health
Yes.
department has always told us that they are having their second dose available, but I have heard that they don't, because they don't schedule, they don't always
Oh,
confirm.
there we go, Cindy.
Oh, at Hy-Vee.
Gosh, I don't know.
I can reach out to the health department and find out if they're able to take those, or take a waiting list of people. We have done a couple of those where there's been sometimes we have people that don't show up. So I should say that also. We never waste a dose. So if some people don't come to their appointment, we call all over. And so we've worked with the health department, for example, if they have people in a scenario like you, and we have fit them in. So we could get information from you, and I would contact the health department and see if they can assist with it.
I do find that I do find that odd though, is that I would think places would have like something worked out where like if you get your first dose, then yeah, they'd have a second dose coming, or they wouldn't do the anyhow. It just that sounds a little odd. But anyhow, that's we don't control. We're working hard for ourselves to make sure we have it going smoothly, which your team does, Cindy. But outside of us, yeah, we don't have control on that. There was embedded in that comment also a question about how long can you wait. I don't know. So I think it was Moderna, what Rebecca said, and that's a month, February 26th. So, um, Cindy, you could correct me if I'm wrong on this. I think there's definitely some fudge factor of a week or two between, that first actually you can get a little bit sooner than a month or a little bit after the month. It's, there's a little fudge factor in that. And I think the CDC would say whenever you can get that second shot, get it after that month. It's ideal to get it within that 30-day window because the studies were done, the clinical trials were done based upon that dosage schedule. But I think if you had to wait another week or two to get it, it wouldn't be ideal, but it wouldn't be the end of the world either. And I think that second vaccine would still be indicated.
Yeah, and you don't have to start over either,
Right.
from what I've understood.
Yeah,
So,
that's my understanding as well. So, okay, a list down here, long waiting list. Can I sign up for CGH for when I get home at the end of April? You bet. I think they can, can't they, Cindy?
yeah, absolutely. You can get on.
Yeah. Now, granted, if we call you and you're not around, that happens. Even with our 85 plus list, I'm guessing.
Yeah, we are keeping track of those that are gone currently. We keep them current on the list. And then, if we get doses available, then yeah, we can add you later when you do get home. But I would go ahead and get on there.
Yep. Yep. Good. All right. Cindy, thank you. I knew that we'd have a lot of questions and comments because obviously right now, we have these vaccines, at least they're becoming more available. We know that they're effective. We know that they can help people. We know they can have a big impact in terms of this pandemic. It's so exciting to think, first of all, to have in less than a year to have a vaccine available it's amazing. If you look at other vaccines and how long it took for them to develop. So the fact that we have these vaccines and have an opportunity to bend the curve on this pandemic is it's so nice. But yeah, I knew that folks would be interested in getting more information about the vaccines. Thank you, Cindy, because obviously you're right on top of what's going on with the vaccines, and thank you for all the information you've shared. And for those folks who are interested, we will continue to give updates on our website about the latest and greatest of our vaccines. And we talked earlier in this conversation, we're going to start just posting there we go, updates on our vaccine wait list and how many vaccinations we've given and all that type of stuff. So Cindy, thanks again for being here on the broadcast with me. It's been really good.
Yeah, thanks a lot. I'm glad we had the opportunity.
Yeah. All right. Thanks.